Hi, my name is Mike Studer, and I'm proud to be here to talk to you about a brand new technology, a software program that can help you practice smarter. This is called Rapid, and it is available for you to be able to practice now. I want to show you how intuitive it is across many different diagnostic categories and enabling you, your colleagues, in your program to practice smarter, improving your practice truly one person at a time rapidly. All right, so what does Rapid bring and why would you need this for your practice? First and foremost, you might want to think practically about how Rapid can help your program and the therapists that participate in the program. Those might be your employees, your colleagues, or you yourself. Having an objective, accountable, balance and functional assessment is something that's valuable for geriatrics, pediatrics, neurology, orthopedics, sport performance, skill development, and all. It is currently being used in all of those clinics, all the way from Major League Baseball and professional golf, all the way through skilled nursing facilities, assisted living facilities, wellness programming, etc. It brings accountability. I've got and an opportunity to be able to allow technology to speak to my patient irrefutably. This is your score. And it brings accountability to the program. Let's find out. I've given you a program to work on for your strength, for your foot posture, for your balance. Let's find out together, did I make a difference in you? So accountability. Scientific credibility, we're going to talk about a lot today, to be able to make your program and you as a professional more credible, more of someone that has something that is bringing logic and bringing evidence to my healthcare. We're going to talk about psychology, though, too. The measurements that you can get from Rapid allow normal tendencies in human beings to exist. I want to see if I can beat my score. Gamification. Let me see if I can do that better. I'm working on my home exercise program at home. I want to see it turn over into something and make certain that I am being measured as improving. The halo effect is obviously there as well, so that when a program or a therapist has technology like this, we are seen for exactly what we are. Someone that reinvests in a program and cares about the type of healthcare that we're bringing. That type of mentality psychologically rings through our patient experience, keeping them more engaged. We're going to talk also about some diagnosis-specific benefits, helping you engage with clients, orthopedics, sports, wellness, stroke, Parkinson's disease, vestibulopathy, cerebral palsy could be thrown in there as well, concussion, all the way up and down the line. Rapid brings those things to us. Let's take a couple of those points and highlight them now. Currently, Rapid is being utilized in research programs, including this one here at the Mayo Clinic, and I'm involved in this one as well, utilizing the Rapid profiling for balance testing and for capacities with sit-to-stand movements, really investigating how well individuals are ready to function after cardiac rehabilitation. And there are other studies that are utilizing this as well right now. So having scientific credibility and accountability brings what to you? It brings a measure of professionalism that helps you with referral sources, payers having objective measures that are irrefutable when you are positioning yourself for authorization and also positioning yourself for appeals. It also brings something else that's inherent to your program if you want to participate in case study research and elevate your practice in that manner. Additionally, can help you with return to play clearance for ACL, for concussion, return to work for persons that have been injured in work-related matters, as well as I've spoken to, it helps you with the credibility that's inherent for all of these experiences, patient engagement. Now, let's explore the realm of psychology just a little bit. Here you see me pointing the results of a modified clinical test of sensory interaction and balance the results out to the patient right after she gets through with a score. She gets the opportunity to see she has improved. Where can she go to from here? Enhanced expectancies, gamification. I've beat the score. I expect I'm getting better. I think I can beat the score again. I can hold myself more stable. I can walk more briskly. I can perform more sit to stands. Confidence in self-efficacy. I am beating my last score right now. I'm doing something healthy. We know that that is dopaminergic, inhibits the release of stressful cortisol, and helps us with an antidepressant of serotonin. I'm getting healthier. And then finally, as I alluded, the halo effect. I believe in my therapist and this practice. They have invested in sophisticated technology. All three of these are just a brief summary of what Rapid can do on a psychological level. Let's take a little deeper dive and look at diagnosis-specific benefits. Here's a list that I'm not going to read to you. You can read it for yourself. I'm going to take the next slide and explode these and give you some more detail. But I want you to see this handheld tablet helping us interact with the patient, allowing them to see objective scores for things that are important to them. My walking score, my balance score, my agility score, my dual tasking score. All of these are available and really readily and intuitive for the Rapid program. So let's blow these out just a little bit as we wrap up. General imbalance, very clear on this one. And I'm just going to briefly introduce a couple of attributes that Rapid can bring. This is not a comprehensive list. We can do the CAT-SIB, the 4-stage balance test, a timed up and go. For general imbalance, we've got you covered. How about vestibulopathy? Well, how about your capacity to not just say, you look like you didn't sway as much as last time. And I can look at the differentials in a presentation with a CAT-SIB in condition number 2, stand still, eyes closed, firm surface, and condition number 4, stand still, eyes closed, cushion surface. What am I getting with that? Well, we removed the eyes out of both of those, and we systematically took some of the somatosensory capacities, that mode of sensation, away from you in condition 4. That leaves you in condition 4 with essentially a proficient or a deficient, impaired vestibular system, peripheral end organs or central, to be able to demonstrate how do you do when we take 2 of your 3 sensory systems away and leave you with the central and peripheral vestibular apparatus. Just really a nice opportunity to cleanly educate a patient and confirm a diagnosis. Neuropathy, same type of opportunities available, but we look at the comparison for different performance there. We can look at the difference between condition 1 and 3 for neuropathy, and I'm just trying to give you a brief overview here. We can go much deeper than this, so please allow me some latitude. Condition 1, eyes open, stand firm surface. You've got your eyes, you've got your inner ears, your vestibular systems centrally, and your somatosensation available. If your performance in condition 3, stand still, eyes open, cushion surface, is no worse than condition 1, that gives me the start of a hint, again, latitude please, to understand that you were never using your somatosensation in the first place. So when I altered it, when I took it away from you and put you in condition 3, cushion surface, it didn't matter to you. You weren't using it because you've got neuropathy. Again, latitude on that because it's just a screener. We can dive deeper into these considerations. How about concussion? How about testing an entire football team, cheerleading squad, soccer team before a season starts in single task balance and in dual task? And then having any of those athletes that come back that have been concussed, test again, comparing against their performance, pre versus post. Before I can clear you to return back to the court, the pitch, the field, let's get you back to an accountability setting that says you are as healthy as you were at the start of the season. If that sounds great and sounds like a wonderful research project, believe me, that's already being done. I'm involved in that. And that's something that you can use Rapid for right now in the school settings, semi-pro and professional settings. Cervicogenic dizziness. Looking at this, a very challenging condition sometimes to create a true differential diagnosis. Is it vestibulopathy? Is it neuropathy? Is it cervicogenic dizziness? What are we getting here? And one easy thing to do, again, just briefly, having the individual test with their clinical test for sensory interaction and balance facing straight forward, and then do a body on head rotation and having the individual try to test again, same cat sib in those conditions where we have put tension on the neck. Let's see if there's a difference there. We haven't changed the vestibular system orientation. We have not changed your somatosensation. We've changed the neck position. How about stroke? So much to talk about here. Timed up and go, 4-stage balance, cat sib, looking at symmetry scores, looking at weight bearing, looking at endurance to be able to stand. Many different opportunities here, and the percentages are given to you in an objective fashion. And I'll introduce one thing additional here in stroke, and that is the concept of sway DLs, something that we've developed to be able to objectify, listen closely, objectify the amount of sway that you experience while you are working on getting dressed. That can be done in sitting, that can be done in standing. One pant leg is already threaded through. Let's see how much you sway as you pull your pants up, or as you pull a shirt on, or as you brush your teeth. Sway DLs, I know that you get that. How about Parkinson's disease? We can do balance assessments in sitting as you transition up to standing, sit to stand, look at the degree of retropulsiveness that you've got, where your weight distribution is, do a timed up and go with you, and we can help your specific presentation of Parkinson's disease in that manner. How about frailty? Sway DLs, as I've already expressed, being able to take an occupational therapy assessment and make it more objective, help to be able to create an environment where we have the defensible documentation for an individual that's been on therapy for 6 weeks, 8 weeks, 10 weeks, but still improving in measurable manners here using the sway DLs, testing you sitting, standing, dressing, etc. Endurance standing, and again, separate from sway DLs, just your ability to endure for a full 20 seconds standing and not experience tremor from your frailty or not have to sit back down. We can measure that. How about low-level testing possibilities in sitting with compliant surfaces or firm surfaces, eyes open, eyes closed? We can do a full cat sib with you seated. Okay, how about orthopedics? Foot subtyping, symmetry, kinesthetic training, after surgery, after injury, elevating the athlete's degree of confidence. Resource training can be informed based on the symmetry scores or asymmetry that we see. All of this that I explained to you in 2 minutes just on diagnosis specific. Let's wrap up here by taking a consideration at the multidisciplinary benefits that I alluded to. Physical, occupational, and yes, speech language pathology. We can test balance in ADLs. I expressed that to you, sway DLs. We can also test balance with a cognitive interference. We call that dual tasking. That can be done in gait, sitting balance, standing balance, what the team would decide. You can overload something like recall these 4 digits while you're also trying to keep your balance. Work on spelling a word backwards. So digit span. We can do serial subtraction. We can do a hailing sentence inhibition task. And if you're not familiar with that, you can look at it. You can layer different cognitive tasks onto the attributes of the skills that Rapid can already test. And all 3 disciplines can benefit from this. So you can test functional movements. You can objectively build programs for your patient as a team, and you can collaborate in an objective manner. So I want to share all of these things with you. I'm excited clearly about Rapid. I hope you can take this opportunity to be able to kick the door open and investigate more with Rapid for yourself as well. Thank you so much.